Everyone, welcome to researchmd.com. We got a great presentation. We're going to teach you everything about hypermagnesemia today. Another very important electrolyte abnormality. We have given talks about hypomagnesemia. Now today our topic is hypermagnesemia. I just wanted to make sure we're going to teach all the important facts under 9 minutes. Okay, so make sure you repeatedly watch. The repetition is the key, so it stays in our memory for a very long time. There's no point in watching like an hour-long video if you don't have the time to repeatedly watch the video. So that's our purpose. 9-minute review for hypermagnesemia, my friend. Again, my name is Pramil. Cheriyath. I'm a program director, internal medicine residency, transitional residency. I teach medical students and medical residents on a regular basis. I'm also a director of research, assistant professor of medicine, 2 major medical schools. Let's get into our topic. So what is hypermagnesemia? Magnesium levels high. How high? First, we need to know what is the normal range, right? What is the normal range? 1.5 to 2. So if you had to pick a number, normal range is 2, around 2, okay? So if the serum magnesium between 2 and 3, you can say that is hypermagnesemia. If it becomes greater than 4, becomes severe hypermagnesemia. That's where more complications going to happen. So let's look at a little bit of epidemiology. In the United States, it's not that very common, it's rare, but look at the prognosis in the paper. This is very striking. When somebody did a study, 5,339 patients with the plasma magnesium concentration higher, and so they reported that 36.9% of the 151 patients with the hypermagnesemia died. Very scary. Okay, so there is increased risk of mortality. Okay, so etiology, like what are the causes? Main thing you have to know about kidney. This is where magnesium regulatory system is working through the urinary excretion. That's the regulatory mechanism right there. Okay, so you have to be very careful in the patient with end-stage renal disease, plasma magnesium concentration between 2 and 3. Severe symptomatic hypermagnesemia can also be induced by exogenous magnesium is given as an antacid, laxative, and all those kind of things. Okay, so be careful. Hypermagnesemia, 10 to 15 percentage of the hospitalized patient in the kidney failure. So always think about if their kidneys are failing, hypermagnesemia risk is high. Magnesium infusions, and if you give like too much magnesium, then you can have it. Oral ingestion, massive oral ingestion, it can cause exceed the renal excretory capacity, particularly if there's underlying renal disease like chronic kidney disease. Okay, and then even like accidental overdose with over-the-counter product like Epsom salt, which contains like 100% magnesium. Laxative is a big source. Magnesium enema can also, substantial quantities of magnesium can be absorbed from the large bowel following the magnesium enema, so you have to be careful. And also you have to worry about malignancy with the tumor lysis syndrome. Yeah, and somebody come with a rhabdomyolysis. Those are the other things. Okay, to summarize, so we have to think about kidney impairment at number 1, magnesium infusion, oral ingestion, magnesium enema, and then it's the cell breakdown. So when you look at the pathophysiology, when you have like too much, look at the diagram very clearly. Okay, if you have too much magnesium, it's going to affect the voltage-gated calcium channel. That's what you have to know. So what happens? So there's going to be decreased calcium entry into the neuromuscular junction, and there is no action potential to have this muscle contraction and all that to work. So there's going to be muscle paralysis. Those are then flaccid quadriplegia. Those are the main thing, and it can also eventually can affect the respiratory system. Patients stop breathing, so be careful. That's where the deadliest consequence is going to happen. Cardiovascular is also very important. Okay, make sure if you have hypermagnesemia to check an EKG. What are the findings you can find? I'm going to say prolongation of the PR interval, increase in the QRS duration, increased QT interval, complete heart block, and cardiac arrest may follow. So remember, this is very, very deadly. Look at you get an EKG when there's like a hypermagnesemia. Hypocalcemia can also can happen in this situation when there's hypermagnesemia because they inhibit the secretion of the PTH hormone. Remember that, okay? And long-term hypermagnesemia can contribute to osteomalacia, renal osteodystrophy, hypertrophy and dynamic bone loss, especially in poor patients with the chronic kidney disease. So what are the clinical features? So let's look at them. Like if the plasma magnesium concentrations like 4 to 6, you can have like nausea, flushing, headache, lethargy, drowsiness, and diminished tendon reflexes. Okay, and then magnesium concentration between 6 to 10, somnolence, hypocalcemia, absent tendon reflexes, hypotension, bradycardia, and EKG changes can happen. And when plasma magnesium goes above 10, muscle paralysis, flaccid quadriplegia, respiratory muscle failure, complete heart block, cardiac arrest, and the death follows. Okay, and then how do you diagnose it? We already talked. You measure the magnesium level. If it is serum magnesium greater than like 2 or greater than 2.6, we can clearly say that. A serum magnesium concentration 6 to 12. The EKG changes we already talked about. Deep tendon reflexes will disappear when it goes high. So treatment, how do you treat it? What are the treatments available? One is calcium gluconate you can give. Dialysis also, if there's like chronic kidney disease, the patient, severe magnesemia, you have to consider that. Diuresis, IV Lasix have a little bit of effect on it also, okay? So mainly, you need to make sure 10% calcium gluconate. Make sure you provide the respiratory support it need to be, because if the respiratory muscles cannot work, then it's going to be respiratory failure, and that's going to be a problem. And then you got, hemodialysis, we already talked about it, okay? Thank you so much for watching. We'll be back with another presentation soon. Please subscribe to our channel. Thank you.